Hello, how are you? Many people who have an itch tend to associate it with something simpler, like a skin allergy caused by a soap, a new fabric softener they used, or even bedding that started to prickle and bother them. But there are some types of itching that are related to blood diseases, liver problems, the lymphatic system, and even some types of cancer. In this video, I'm going to tell you about 5 areas of the body that you need to pay close attention to if you have itching. It could be a sign from your body that something is wrong. Stay until the end. You won't want to miss it. Before we start, I want to ask you, have you been feeling itchy? Did this itching start today? Did it start a short while ago? Or has it been going on for months or even years? There are people who tell me, Patricia, this itching won't leave me alone. It's in such and such a place. Stay until the end. You won't want to miss it. And tell me which itching bothers you the most. When we think about the place that itches, which bothers many people, the first place that often bothers them is the calf, the shin, and it can be a warning from your lymphatic system and your circulation. Imagine a person who starts to feel a very intense itching in that region, right? Often they change their soap, their moisturizers, apply ointment, take anti-allergy medication, and nothing solves it. And often, the skin on the leg, on the foot, looks normal, without any significant spots, without obvious irritation. But most of the time, this type of itching is related to a circulation problem, varicose veins, dry skin, or even dermatitis caused by venous insufficiency. In other words, the itching can be a sign that your blood circulation isn't working as it should. There are also some cases where problems related to the lymphatic system can cause persistent itching even before other symptoms appear. So, for you to know whether this itching should be investigated further or not, there are 3 characteristics you should pay attention to. Does it last for more than 4 weeks? That's already a yellow flag. Does it get much worse at night to the point of disrupting your sleep? Another important question. And it hasn't improved with antihistamines, ointments, moisturizers. So if you also notice that besides this, you've been losing weight unintentionally, having night sweats, or experiencing unusual fatigue, it is very important to seek medical evaluation as soon as possible. And sometimes, even a simple, complete blood count can be one of the first steps to help the doctor in the investigation. So if it's a very persistent itch like that, along with these other issues I mentioned to you, it's worth looking into. The second place that can cause unbearable itching in some people, and may be related to a more serious issue, is when the itching is in the middle of the back, between the shoulders, in the region we call the scapula. It's common for us to think that this sensation of itching, stinging, or burning is related to some kind of muscle tension, right? Some posture problem or some spine issue. And it could be, but some liver or bile duct conditions can cause very intense itching, even without any type of skin lesion appearing. When the normal flow of bile is impaired, some substances that should go to the intestine end up accumulating in the blood. This can cause very strong itching in different parts of the body, and some people report feeling a lot of itching, especially in the back area. Furthermore, there is another health condition, specifically regarding the back area, called notalgia paresthetica, which is caused by the irritation of small nerves in that area of the back. It causes persistent itching between the shoulder blades, and in this case, it is not related to the liver, but rather to the nervous system. So it is worth investigating as well, if that is the case. Warning signs of itching are also related to nausea, feeling unwell after meals, especially very fatty meals, right, which demand more from the liver. Yellowing of the skin or eyes, yellowish mucous membranes, dark urine, and pale stools. This may indicate a liver problem, and it is worth seeing a doctor, especially if the itching has been persistent for many weeks. And tell me here in the comments if this has ever happened to you. I really like to know about your experiences. The third place that deserves a lot of attention, especially in the case of women, is the chest and nipple area, because this persistent itching can often be accompanied by redness, problems like that after sweat, friction from clothing, or a new soap, laundry detergent, or even the bra can irritate the skin. So sometimes it really is nothing more serious. But there is a situation where itching should not be ignored. Some types of skin cancer, especially Paget's disease of the breast and inflammatory breast cancer, can start with skin changes before a lump appears. This is very important to mention. So be alert if this itching is only in one breast or is accompanied by signs such as a sore or peeling that doesn't heal, retraction, or a change in the shape of your nipple from how it was before, reddened, hardened skin with an appearance relatively similar to an orange peel, and an increase in temperature in just one of the breasts. If you notice any of these signs, you must see a gynecologist or doctor as soon as possible. And then perhaps they will order other complementary exams, such as a mammogram, ultrasound, and other things. Always remember that in more serious cases like cancer, the sooner you notice a change and the sooner you go to the doctor, the greater the chance of treatment and cure. So the most important thing is that for any abrupt change, right, that occurs in your breasts, you should see a doctor. Another area that deserves attention is when the scalp itches a lot, but when the scalp is clean, without dandruff, without flaking, without sores, without psoriasis, without an allergy to hair dye, without an allergy to bleach, because that happens too, right? Sometimes these chemicals that people put in their hair can cause some type of allergy and cause itching. But most of the time, right, these scalp issues are really easy to investigate, easy to treat, but when it persists for a long time and the skin looks completely normal, it's worth investigating because some blood diseases can cause this specific type of symptom before other signs appear. So many people even report that it doesn't feel like a normal itch. It feels more like tingling, little pricks, or the impression that something is crawling on their head, but there are no lice. It's worth mentioning that too. So if in addition to that, you notice small purple spots without having bumped into anything, frequent bleeding gums, or intense fatigue that doesn't go away even after sleeping well, it's worth seeking medical evaluation. Because in these situations, a complete blood count can be one of the first easy tests a doctor might order to investigate this. The fifth location is usually a taboo for many people. Many people put off going to the doctor out of embarrassment when they have persistent itching in the anal region or in the intimate area, right? For example, in the vaginal area for women or the penis area for men. It is very common for people to think the problem is a fungal infection, candidiasis, hemorrhoids, irritation from toilet paper, and most of the time it may just be that. But when this itching lasts for weeks, does not improve with the usual treatments, and keeps coming back, it deserves a more careful investigation. In some cases, certain precancerous changes or even some types of cancer in the anal or vulvar region can start precisely with persistent itching even before causing pain or bleeding. So it is very important that you also stay alert. If this itching lasts for more than 3 or 4 weeks, if it doesn't improve with the ointments and treatments that you normally use that are indicated for fungal infections or hemorrhoids, if the skin has changed color, if the skin has become lighter or darker, or if there is any sore that won't heal, and if this itching gets much worse at night. Some of these changes may be related to an HPV infection, and this also requires medical follow-up that should be done to prevent cervical cancer. So feeling embarrassed can be very harmful and delay your diagnosis. A simple examination by a gynecologist, urologist, proctologist can quickly clarify the cause and allow for the start of appropriate treatment. Once again, as I told you, when we talk about more serious diseases like cancer, the sooner we start treatment, the better the outcome tends to be. So remember not to be embarrassed and to seek help if you are also experiencing itching in that region. To finish, I want to tell you that there are indeed some types of itching that are benign, so to speak. For example, if along with the itching your skin is peeling, red, has little bumps, or if you apply an anti-allergy ointment or moisturizer and it gets better, it's usually a dermatological skin issue. Even so, if this itching lasts for a long time, it's worth going to a dermatologist to investigate if there's any further problem. It may not be a serious problem, but it should be treated. Also remember that one of the things you can do if you have itching is to change the products you already use. For example, change your soap, change your moisturizer, change your shampoo, or even change the laundry detergent or fabric softener you use. Wash and give an extra rinse when washing both your clothes and bedding to avoid the buildup of residue. It can also be a strategy to check if this itching is really just a more benign issue, like an allergy or a more serious matter that needs to be investigated. So tell me in the comments if there's any place that has been itching for a long time you went to the doctor and discovered a more serious problem. I would love to see your comment. Remember to leave a like on the video, it's very important to me, and also to share it with anyone who might be dealing with itching or discomfort. Let's expand our chain of kindness. That's what I want with the channel. See you next time. Bye.